Thank you for joining Planet PCR on April 10. I'm welcoming Dr. Farrel Hellig from Johannesburg. Farrel is course director of Africa PCR, and Dr. Khaled Al-Shaibi from Jeddah, who's working with us on Gulf PCR. Jim, course co-director. So let me turn to you, Farrel. How is the situation of the epidemic in South Africa and Johannesburg at the moment?
Thank you, William. It's a pleasure to join you from my home in Johannesburg. As you can see, I'm at my home because everybody in South Africa is at home. We're in the middle of a very extreme national lockdown where the entire country is confined to their homes, who are not permitted to walk in the street. The lockdown is managed by the military. So we're in initial 3-week lockdown, and Johannesburg is a ghost town. I have a permit to drive to the hospital, and there's 1 or 2 cars on the road, but those are only people performing essential services. The epidemic itself is at a very early stage. This lockdown was implemented very early in South Africa when there were just under 1,000 cases. And at the beginning of the lockdown, cases were growing at 40% per day. Since the lockdown, which is now 2 weeks in, the case daily growth rate has reduced to 4%. So it seems that this extreme lockdown has made a difference. Whether testing is optimal is a question, but despite that, it seems like it's working.
Yeah. And in Jeddah, Khaled, is the situation that you experience similar? And
pretty similar in many ways. I also believe we're still at a relatively early stage. The total number of cases that have been recorded in Saudi as of yesterday, when I last checked, was just about 3,000 cases. Again, in a very similar fashion to that described by Dr. Hellig. Saudi Arabia instituted a countrywide lockdown just over 3 weeks ago and took unprecedented steps in a Muslim country, and Saudi Arabia in particular. All mosques were closed, including the grand mosques of Mecca and Medina. People performing the ritual prayers in around the Kaaba. All this has been stopped now for 3 weeks, and there is a very tight lockdown. Only essential services continue. So the streets are pretty much empty, as described by Farrel.
And how is the situation in the hospital? I understand you don't have an overflow of patients, yet is your practice reorganized? What is the activity in the cath lab?
Well, yes, we have had to do quite a bit of organization. The whole hospital has been reorganized. The hospital, essentially 2 main buildings. One has been designated sort of the COVID building, and the other the non-COVID building. So all patients, the ICUs that deal with COVID patients, the wards that deal with COVID patients are in one building, while all other non-COVID related medical conditions are treated in another building. Within the cardiology department, we have divided ourselves into sort of 3 groups, and we take 14-day rotations. You're either dealing with COVID patients, or you're dealing with non-COVID patients, or you have a 2-week period where you're off, sort of self-isolate, and if anybody falls sick or has a problem, you can jump in and substitute. So that's how we've had to reorganize our rotas and reorganize the way we deal with things. We have stopped all elective admissions. All clinics have been suspended, but we continue to run clinics in a virtual manner using technology and mobile phones. And patients get their refills delivered by courier services, which are one of the essential services that continue to run in the country.
Mm-hmm. But I mean, when a patient comes in, you do not always know whether he's COVID or she is COVID positive or negative. So you have an intermediate solution there,
yes.
or
the hospital set up a mobile hospital in the parking lot. It's a 50-bed hospital, essentially functioning as a screening center. So patients go through there, are screened. They have low likelihood, no respiratory symptoms, nothing. Then they get triaged into the emergency room and they're dealt with in a conventional manner. If there's any suspicion, they're screened and held there until the COVID status is clarified. We are able to run the test in the hospital, and the turnaround time is around 3 to 4 hours. Critically ill patients are treated as COVID positive and shuttled to the intensive care unit.
Oh, that's very useful information. Thank you. Farrel, what about your activity? I know you're receiving lots of referrals for complicated elective cases. What are you still able to, which patients are you still able to treat?
That's an interesting question. To mention that our total numbers are just under 2,000 in the country at the moment. And so the likelihood of someone being COVID positive remains fairly low still at this point in time. Every patient walking through the door of the hospital requires a clinical screen for travel, contacts, and symptoms. And those patients are triaged to one side where if they have any suspicion, they are investigated further. However, we've just received last night a new directive that no patient will enter the hospital unless they've been tested. That's for non-urgent cases, patients who need to be at the hospital but are not critical and can spend some time waiting for a test result. So a lot of my referrals are patients who don't fit into a true emergency situation where they, like a STEMI, where time is the essence. So there may be a left main who's relatively unstable but can wait a few hours for a test result. And so we are continuing with those cases who we deem to be somewhat elective but not able to wait many weeks for resolution of their clinical symptoms, so their clinical situation, such as a very severe aortic stenosis who we're concerned about waiting many weeks, or severe ischemic coronary case who we feel can't wait many weeks. So we continue with those sort of cases, and we continue with our primary PCR service. We are not treating everybody as COVID positive if we do not know their status. We take precautions, but we're not using full PPE on every case. We only use full PPE if we know they're COVID positive, which has not been the case yet, in fact, in our hospital. We have a designated room for COVID positive patients, which would be our hybrid cath lab, which has laminar flow aircon with negative pressure. So we could treat COVID patients in there with full PPE. All staff are trained on how to use PPE, and they have to be certified. There is a training program within the hospital. At this stage, we've got COVID patients in our hospital, but they have not had cardiac issues. So we have not faced the situation of having to manage a COVID patient as far as we know.
Yes, great. And the same for you, Khaled. Your daily activity still includes some elective cases. You mentioned that all the outpatient clinic is cancelled and is taking place via telemedicine.
Yes.
But what about the cath lab activity?
Well, the emergency room is still functioning normally, and we still get a large proportion of patients through the emergency room who are triaged as low-risk COVID, and we continue to treat them normally. We've put down guidelines for how we're going to deal with STEMIs and high-risk non-STEMIs if the situation is unclear. We have also designated a specific lab to deal with COVID positive or COVID highly suspect cases. And as Farrel mentioned, the staff have all been instructed and trained on appropriate use of PPE, how to gown and remove the gowns and all that stuff. But most of our patients are coming through the emergency room, and we continue to provide the service we normally do for those patients. Again, as Farrel mentioned, we're still relatively early in the slope, I guess, or of the COVID crisis here, with only 3,000 patients countrywide. So we still have a large amount of patients who come through the emergency room with non-STEMIs and STEMIs who really have a low risk for COVID, and we continue to treat them normally.
We do hear from different regions that the perception is that the number of patients with non-STEMI and STEMI is actually less than what you would normally expect. Have you experienced anything similar? Doesn't sound like from your account.
No, the emergency room volume has come down. I mean, we'd frequently see patients coming with chest pain, unstable angina, or these small non-STEMIs. Those patients, we don't see them anymore. The only ones who come are the ones who are really sick. So, the STEMI or the unstable angina with pulmonary edema, those type of patients. So it seems like patients try to stay away from the hospital. They're scared of coming to the hospital, and only the ones who are really sick or in trouble tend to show up.
Yes.
And we continue to provide service to those patients.
And Farrel, would you care to say a few words about, the situation perhaps in other parts of the country, South Africa, or perhaps through your African network, PASCAR, what's going on the continent?
Yes, well, there has been an outbreak at one of the hospitals in South Africa, and there were 47 staff members who contracted COVID in a very short space of time. And there was some protocol issue that led to a small outbreak that has been contained. And that's led to a lot of concern about what the protocols need to be. So not every hospital has been free of incidents such as ours, and hence the more strict screening that's been adopted recently. In terms of the rest of the country, South Africa is a very diverse place with places as sophisticated as Europe, and yet places which are in severe poverty with severe overcrowding. And the rest of Africa even more so, where there's enormous overcrowding and poverty and congestion. And the potential for this virus to have a runaway devastation is significant within the continent itself. So our president of our country, who's demonstrated extremely strong leadership, and in fact has been a role model to the rest of the world as far as I'm concerned, is actually the president of the African Union, and he's trying to implement this lockdown on a more continental scale. And I think the numbers remain small within Africa. Whether these other factors such as BCG vaccination and other unknown contributors, perhaps climate in sub-Sahara being warmer at this point in time, we don't really know what influence these factors may have, but it looks like the numbers are so far not too bad in the continent, and fingers crossed we'll be able to contain this to some extent. But if we do lose control in Africa, I think it's of grave concern.
And in your region, Khaled, it's impossible to forecast what's going to happen, but what do you think? You think you'll be able to contain the epidemic, or are you still concerned that you might be hit by, an overflow and a wave of many patients?
Everybody's still very, very concerned. I mean, this lockdown's been going for 3 weeks, and I don't see any indicator. I have no contact with government officials, but my reading of the news broadcasters, they don't seem to have any intention of releasing this lockdown for a while still. And again, for the Muslim world, Ramadan is coming up, and I still think they're going to continue with mosque closures and all this through the month of Ramadan. So I don't see any let up on the lockdown in the foreseeable future. I may be mistaken, but I think that's probably the thing that's saving us right down, and we're only seeing the figures we are seeing, which are relatively modest, is because of a widespread lockdown.
Thank you to both of you, and maybe Khaled and Farrel. Khaled, if you have strong message or experience that you would like to share in a few words before we conclude this conversation, something you would like to share with the community.
Well, yeah, I think as cardiovascular care providers, we should continue to try and provide the best care, guideline-directed care for as long as we can, as long as hospitals and healthcare systems are not overwhelmed. And here in Saudi, and my reading from what Farrel has said, maybe in South Africa till now, is the healthcare systems are not being overrun right now, and we still should be able to continue to provide the service our cardiovascular patients need.
Farrel?
Yes, I think it's a difficult balance to achieve this a fully staffed hospital with nothing to do versus a fully staffed hospital. So you need this preparedness, and a fully staffed hospital that can still provide essential services. So I think we do need to strike that balance between preparedness and continuing to provide essential services. And our lockdown has just been extended for a further 2 weeks in this country as of last night. And I think what's impressed me is how the country has been able to unify and work together despite a great deal of diversity. We're a very cosmopolitan nation, and how politics has been set aside. And I think it's a message of what can actually be achieved. And I think if we remove all the politics and just focus on the problem at hand, we can actually make a lot of progress in many parts of the world.
Thank you so much for joining Planet PCR. It was great to hear from you and to have news from yourself, colleagues, and the situation in your area. Thank you for sharing your experience, and let's stay connected.
Thank you.